Degloving injuries are severe traumatic incidents where a large section of the skin and underlying tissue is torn away from the muscles, tendons or bones beneath it. This type of injury exposes the affected area, often leading to a significant blood loss, intense pain and a high risk of infection. Immediate and appropriate first aid is crucial to improve the chances of recovery. The first step in managing a degloving injury is immediately calling for emergency medical assistance. Due to their severity, these injuries require urgent medical attention. While waiting for emergency responders, it's essential to control bleeding. Apply direct pressure to the wound using a clean cloth or sterile dressing. If the bleeding is severe and uncontrollable, a tourniquet may be necessary. Place the tourniquet above the injury site, but be cautious as improper use can cause additional damage. Preventing infection is another critical aspect of first aid. Cover the wound with a sterile non-stick dressing or a clean cloth, avoiding any attempt to clean the wound as this can make the injury worse. If possible, carefully collect any torn skin or tissues. Wrap it in a clean, dry cloth and place it in a waterproof bag. Keep the bag cool by placing it near ice, but avoid direct contact with the ice to prevent further tissue damage. Keeping the injured person calm and still is vital. Help them to lie down and, if possible, elevate the affected area to reduce swelling and bleeding. Reassure them and keep them calm to reduce the risk of shock. Monitoring them for signs of shock is also essential. Look for pale, clammy skin, rapid breathing or a weak pulse. Keep the person warm and comfortable while waiting for the emergency medical services to arrive.